Stoicism versus modern psychology. Which is more effective for personal growth? In the pursuit of personal growth, individuals often turn to philosophical and psychological frameworks to guide their journey. Two prominent approaches are Stoicism, an ancient Greek philosophy, and modern psychology, a scientific discipline that has evolved significantly over the past century. Each offers unique insights and tools for self-improvement, but which is more effective for personal growth? This essay explores the strengths and limitations of both Stoicism and modern psychology to determine their relative effectiveness. Stoicism, enduring wisdom from antiquity. Stoicism, founded in the early 3rd century BCE by Zeno of Citium, emphasizes the development of self-control and resilience through rational thinking and virtue. Central to Stoicism is the concept of focusing on what is within one's control and accepting what is not. This philosophy teaches that by aligning one's life with nature and reason, individuals can achieve tranquility and freedom from destructive emotions. Strengths of Stoicism. Focus on control. Stoicism's emphasis on distinguishing between what we can and cannot control provides a practical framework for reducing anxiety and stress. By accepting what we cannot change, we can redirect our energy towards positive actions and attitudes. For example, if someone loses their job, a Stoic approach would be to accept this fact and focus on what can be done next, such as improving skills, seeking new opportunities, or reevaluating career goals. Resilience and endurance. Stoicism promotes resilience by encouraging individuals to view challenges as opportunities for growth. The practice of premeditatio malorum, anticipating potential problems, helps individuals prepare mentally for adversity, enhancing their ability to cope with difficulties. For instance, if a Stoic is preparing for a difficult exam, they might consider the worst-case scenarios and plan how to address them, reducing fear and increasing preparedness. Moral virtue. Stoicism's commitment to virtues, such as wisdom, courage, justice, and temperance, fosters a strong ethical foundation. This moral clarity can guide personal decisions and behaviors, promoting consistent personal growth. A Stoic might, for instance, choose to act justly even when it is not in their immediate self-interest, knowing that virtue is a reward in itself. Practical wisdom. Stoicism offers practical wisdom that is applicable in everyday life. The teachings of Stoic philosophers like Epictetus, Seneca, and Marcus Aurelius are filled with actionable advice on how to live a good life. For example, Marcus Aurelius's Meditations is a collection of personal writings that provides insights into maintaining composure and virtue in the face of life's challenges. Limitations of Stoicism. Emotional suppression. Critics argue that Stoicism can sometimes lead to emotional suppression rather than healthy emotional processing. While detachment from destructive emotions is beneficial, complete emotional detachment may hinder genuine human experiences and relationships. For example, constantly suppressing grief or sadness might prevent someone from fully processing their emotions and could lead to emotional numbness. Limited scope. As a philosophical system, Stoicism may lack the nuanced understanding of complex psychological conditions and individual differences that modern psychology provides. It offers general principles rather than tailored interventions. For instance, while Stoicism might advise maintaining composure and rationality, it may not fully address the needs of someone with clinical depression or anxiety disorders. Cultural and historical context. Stoicism was developed in a specific historical and cultural context, which might limit its applicability in the modern world. Some Stoic practices and beliefs may not resonate with contemporary values and lifestyles. For instance, the Stoic ideal of apatheia, freedom from passion, might be seen as unrealistic or undesirable in a culture that values emotional expression and authenticity. Modern psychology, scientific insights and interventions. Modern psychology, rooted in scientific research, encompasses a wide range of theories and practices aimed at understanding and improving human behavior and mental processes. It includes various therapeutic approaches, such as cognitive behavioral therapy, CBT, psychodynamic therapy, and humanistic psychology, each offering specific techniques for personal growth. Strengths of modern psychology: evidence-based interventions. Modern psychology relies on empirical research to develop effective therapeutic techniques. Evidence-based therapies like CBT have been proven to help individuals manage mental health issues, such as anxiety, depression, and PTSD, by addressing maladaptive thoughts and behaviors. For example, CBT helps individuals reframe negative thinking patterns and develop healthier coping strategies. Holistic understanding. Modern psychology considers the biological, psychological, and social factors that influence behavior and mental health. This comprehensive approach allows for personalized treatment plans that address the unique needs and circumstances of each individual. For instance, a psychologist might combine medication, therapy, and lifestyle changes to help someone manage their mental health more effectively. Emotional expression and processing. Modern psychology encourages the healthy expression and processing of emotions. Therapeutic techniques help individuals understand and manage their emotions, fostering emotional intelligence and resilience. For example, therapy can provide a safe space for individuals to explore and process their emotions, leading to greater self-awareness and emotional health. Diversity of approaches. Modern psychology offers a wide range of therapeutic approaches, from psychoanalysis to mindfulness-based therapies, allowing individuals to find the method that best suits their needs. This diversity ensures that people with different personalities, backgrounds, and issues can find effective help. For example, someone might benefit from the deep exploration of unconscious motives in psychoanalysis, while another person might find mindfulness practices more effective for managing stress. Limitations of modern psychology: complexity and accessibility. The diverse and sometimes complex nature of psychological theories and treatments can be overwhelming. Access to professional psychological help may also be limited by socioeconomic factors, making it less accessible to some individuals. For instance, the cost of therapy can be prohibitive, and there may be a shortage of qualified professionals in some areas. Dependence on therapy. Critics argue that the reliance on therapeutic interventions can create a dependency on external guidance, potentially undermining an individual's sense of autonomy and self-efficacy. For example, someone who relies heavily on their therapist for decision-making might struggle to develop their own problem-solving skills and confidence. Potential for over-pathologizing. There is a risk in modern psychology of over-pathologizing normal human experiences. Not all psychological struggles require a clinical diagnosis or treatment. For instance, experiencing sadness after a loss is a natural part of the grieving process, but it might be mistakenly labeled as depression, requiring medical intervention. Variable quality of practitioners. The effectiveness of psychological interventions can vary significantly depending on the skill and approach of the practitioner. Not all therapists are equally effective, and finding the right fit can be challenging and time-consuming. Case studies and comparative analysis. To further illustrate the effectiveness of Stoicism and modern psychology, let's consider a few hypothetical case studies. Case Study 1. Anxiety management. Stoicism. John, a young professional, experiences frequent anxiety about his career and future. By practicing Stoic techniques, such as focusing on what he can control and accepting what he cannot, he learns to reduce his anxiety. He starts to embrace the Stoic idea that worrying about the future is futile and instead focuses on doing his best in the present. Over time, John's anxiety lessens as he develops a more rational and composed outlook. Modern psychology. Sarah, another young professional, also struggles with anxiety. She seeks help from a psychologist and undergoes CBT. Through therapy, she learns to identify and challenge her negative thought patterns and replace them with more realistic and positive ones. Additionally, she practices mindfulness exercises to stay grounded in the present moment. As a result, Sarah's anxiety becomes more manageable, and she feels more equipped to handle stress. Case Study 2: Coping with Grief. Stoicism. Maria, who recently lost a loved one, turns to Stoic teachings for comfort. She finds solace in the Stoic concept of accepting the natural course of life and death. By reflecting on the inevitability of death and the importance of living a virtuous life, Maria gradually finds peace and strength to move forward while honoring the memory of her loved one. Modern psychology. David, also coping with the loss of a loved one, seeks grief counseling. His therapist helps him navigate the stages of grief, encouraging him to express his emotions and share memories of his loved one. Through supportive therapy sessions, David processes his grief, finding ways to cope, and eventually finding a sense of acceptance and healing. Case Study 3: Personal Development and Fulfillment Stoicism. Emma, seeking greater fulfillment in life, adopts Stoic practices. She begins each day with morning reflections, focusing on her values and how she can live virtuously. By practicing gratitude and mindfulness, Emma finds a deeper sense of purpose and contentment, aligning her actions with her principles. Modern psychology. Alex, also on a quest for personal development, engages in positive psychology interventions. Through strengths-based assessments and goal-setting exercises, he identifies his core values and passions. His psychologist guides him in creating actionable plans to achieve his goals, fostering a sense of accomplishment and fulfillment. Conclusion: integrating strengths for optimal growth. Both Stoicism and modern psychology offer valuable tools for personal growth. Stoicism provides timeless wisdom on resilience, control, and virtue, while modern psychology offers scientifically validated techniques for understanding and improving mental health. Rather than choosing one over the other, integrating the strengths of both approaches may yield the most effective path for personal growth.